Our next panelist is Jeffrey Hammond from Faulkner.
Traditional public health regimes target disease-causing agents in the environment, like the novel coronavirus, and governors issue executive orders to limit the spread of the contagion. Traditional conceptions of public health derive their authority from the state's police powers over the people's health, safety, and welfare to limit the spread and lethality of virulent communicable diseases. Churches have been caught in the vice grip of the current public health orders. Most churches suspended their worship services to comply with governor's stay-at-home orders. Many churches limited the capacity of their worship services and tightly enforced physical distancing and mask wearing after the stay-at-home orders expired. Some churches went beyond the letter of public health orders and made caution the word of the day. My church, for example, has suspended congregational singing and passing the elements of communion. It is therefore confounding to see the governor of Nevada open Las Vegas's casinos at 50% capacity, representing thousands of patrons, while churches are limited to 50 total persons. The denial of Calvary Chapel's injunction application has exposed this. If the right to exercise religion is in fact America's first freedom, and if congregational worship is the heart of that free exercise, it is disheartening at best, portending mendacity and overt religious discrimination at worst, for governors not to respect churches' attempts to comply with public health norms, like social distancing and wearing face coverings, while seemingly ignoring those same norms when the state's economic viability is at stake. For as Justice Alito noted in his dissent, when gamblers are crowded around the craps table, social distancing will likely not be respected. The new public health aligns with so-called social determinants of health. Public health scholars have identified many non-disease factors that affect health and consequently are ripe for regulation, like wealth disparities and access to good food, safe housing, and competent education. Race-based discrimination and police abuses have also been identified as affecting the public's health and must be eradicated in order for all Americans to flourish. This new conception of public health was at play in the District of Columbia when Mayor Muriel Bowser allowed demonstrations against police brutalization of African Americans. Protesters did not consistently respect physical distancing standards. Many in the protests did not wear masks. At the same time, Mayor Bowser indefinitely stopped worship for all but the most modestly sized churches. The Capitol Hill Baptist Church has been completely sidelined by the mayor's order because its interpretation of the New Testament does not allow for virtual services or for serial gatherings of church members. Bowser has shrugged their disparate treatment of protesters and church members, saying, First Amendment protests and large gatherings are not the same because in the United States of America, people can protest. The mayor is correct. People may protest their concerns about police brutality and racial injustices. Advocates of the new public health have applauded such protests, even while churches are deprived of their authority to worship, which compromises religious liberty in our American constitutional order.